It's her house built for women's health, where we talk about innovations that are shaping the future of women's healthcare, answering under-researched topics, and fueling a better quality of life for women. I'm Melissa D'Elia, and after years of frustration, venting to my mom, and trading horror stories with my friends, I'm so thrilled to see awareness and investment actually transforming how our bodies are understood, how our bodies are diagnosed, and really how we're cared for. In each episode, we share stories from real women like you, your mom, your sister, friends, and we interview experts who are tackling women's health challenges head on.
I had my last gynecologist. She was so quick. I feel like you could tell was just very busy and would try to get you in and out. And I feel like her exams were not thorough. Not that you want to be in stirrups forever. And anytime I would ask her questions, it was very dismissive, very quick. I was on birth control for so long, and the pill that I was on wasn't giving me my period. And this was years and years. Every time I would go, I would ask her, I'm not getting my period. You stop taking the birth control, you're going to get back your irregular period, blah, blah, blah. I made the decision to go off birth control. I would say it took a full year for my period to come back regular and for my hormones to regulate and my body to regulate. At that point, I was already seeing a different OB/GYN who wasn't quick and wasn't kind of dismissive and just actually explained, you've been on this for so long, it might take your body some time. And then explained also, if you did want to stay on birth control, there are birth controls out there that will give you your period, even though it's, not really a period because you're on the pill. So I just felt like my previous OB, wasn't hearing me, just was kind of trying to, go through the motions of her job. But I would say that's one thing that stuck out to me is a provider that, takes the time to actually, listen to your concerns and kind of figure out what you need from them, and not just somebody who will just give you an answer, but can intuitively and emotionally pick up your concerns.
Finding a doctor that you trust, that you feel confident in, and if you're really lucky, someone you actually enjoy being around, can feel like an uphill battle. I've been there. Feeling dismissed, feeling rushed, feeling like I paid for something that didn't really get me anywhere, and then feeling like all my information maybe went into a black hole. It's an ongoing cycle, even for people who are attuned to their medical records. But when you find a physician that makes you feel heard, who has the ability to cater to a wide range of needs, and who's using the latest technology, it's beyond refreshing. And that's why I was so excited when I came across our guests today, Dr. Bahar Malekzadeh and Dr. Maral Malekzadeh. They founded and co-own Advanced Women's Health and Surgery and The Well in Westlake, Ohio. Bahar and Maral run their practice through modern technologies and have built an environment that encourages women to take care of their entire beings. As someone who sat in sterile, dark offices of multiple OBGYNs, covering my freezing body with nothing but a crinkled paper towel, seriously, that is such a low bar, their model really resonates with me. It feels like finding a therapist who knows where you're coming from, or a hairdresser who just gets your vision. But their offering is so much more. I'll let Bahar and Maral introduce themselves, but I'm also thrilled to note that they are sisters. As someone who's very close with her own sister, I find it super badass that you guys are building this business and innovating for your patients together.
Thank you, Melissa. Thanks for having us.
Yeah, thank you.
Maybe you guys can just start with what led you both into a professional path of medicine.
Sure, I can start since I'm the older sister. I'm known at the office as Dr. Bahar or just Bahar. I went down the path of completing my medical education and business education. So I did an MD, MBA, and mostly because I thought I'd be more impactful in the administrative side of healthcare, less so on the clinical. So that's kind of where my career started and has been going, and the role that I play at our clinic. And before I turn it over to my sister in terms of her introduction, what got us into medicine was our mother and our third partner, who's not here today, but she is who encouraged us to explore medicine, to pursue medicine, and the reason we're here today.
All right. Yes. Hi, everyone. I'm known as Dr. M in the office. So I'm a board certified OBGYN, and then I went on and did fellowship training with a subspecialty in minimally invasive gynecology surgery. I'm more focused on the gynecology side of the field. And with my training, I'm really focused a lot on benign gynecology surgery with laparoscopic and robotic techniques.
And so circling back to when you guys were growing up together and your mom being an OBGYN, a lot of women don't have access to that information as a young girl. What was that experience like for you, hopefully in a positive light, but then also were there any experiences about what other young girls or patients don't have?
Yeah, I mean, I think we were very fortunate that we had access and education from a very young age, and also understanding how to navigate the healthcare system. That is a challenge I see a lot, especially in our younger patients. How do you navigate the healthcare system? What do you do if you need to see a subspecialty? Or what do you do if you need to place a referral? You know, sometimes it's without a thought because we've kind of grown up in that atmosphere of understanding the process. And I think that's a role that really needs more focus.
It can be overwhelming.
Oh, absolutely.
No matter what age you are.
Oh, yeah, absolutely. I think it's a challenge when I finally get a patient in my exam room. It sometimes takes them months to find where they need to be to find me.
Wow.
Yeah.
And you guys also manage a lot of the patient's needs in terms of navigating the healthcare system. If they need sub-referrals and such, you guys really hold their hand throughout that process.
We do. As a gynecologist, I think both of us do fulfill like a primary care role to try and help fulfill those referrals or what to do next. Where do I call? Where do I go? So to bridge that gap.
Well, I'm glad you have taken those learnings from your mom and built this business from it. I'd love to talk more about your practice. Can you tell us about both sides of your business? What do you offer that's different than a traditional medical setting?
We try to address health, women's health, primarily from the inside out, trying to address all facets of the symptoms that they're experiencing and treat the patient, the whole patient. So we have obviously our gynecology side that addresses your hormones, your gynecologic care, but our wellness side addresses nutrition and behavioral as well as cosmetic concerns that you may have. And we try to do this in a very calm and opulent surrounding so you feel like you're in your home. It doesn't feel like a sterile environment. We've thought about every single exam room. We've thought about how the bathroom feels when you're in there. We have robes that we have you wear when you're there instead of, disposable sheets. So you feel like you're in your home. You're wearing a robe and you're taking care of yourself.
I've been to your guys' office and it does. It feels calm. The color palettes, it just feels super welcoming. It seems like this approach has been taken in a lot of more dental practices, call it like 10 years ago. Nobody likes getting their teeth drilled.
Right.
And so providing that type of experience there really resonates. This is very similar, right?
Yeah.
I mean, I don't think many women enjoy necessarily a PAP, but you're making them feel comfortable in something that's necessary in their healthcare experience.
And it was part of our vision. So get your PAP done and come next door and get a facial. And you've checkmarked what you need to do alongside what you'd like to do. Women leave the practice feeling better that they did their PAP, but they also pampered themselves a little bit.
Yep. You've told me that this practice is something your family would talk about at the dinner table. I can imagine those were some of the conversations.
Yeah, absolutely.
Yeah, I mean, all three of us worked in larger healthcare systems all over the country. So we would get together and constantly express our frustration with how the system needs to be optimized. Everything felt so standardized, and we all wanted a more tailored approach for our patients. It doesn't have to fit certain models because it's been that way for the last 40 years. For example, if you did not have a complicated pregnancy, you get one postpartum visit 6 weeks after your delivery, and that's it. And at that visit, you're talking about birth control if you want it or not. And there's just this whole other aspect to care in the postpartum period. That's the time of support. That's the time to check in with your hormones and see what's going on. And one visit does not cut it. And so this is why a tailored fashion came about.
Yeah, and I think one of the other visions we had was all of our providers are on site every day. So our physicians, our nurse practitioners, and not only are they in communication with one another, they're collaborating with one another. So if one thinks the other has more expertise in hair loss, if one thinks the other has more expertise in gynecologic surgery, they're picking each other's brains and giving that best level of care to their patients, which, that's kind of what we set out to do.
Yep. And your team is there, whether it's from medical expertise or just to give your patient a hug or to ask them how they're doing. The postpartum care really resonates with me, just given where I am with life. And I just think it's so important that we're there not only to celebrate these babies, but to celebrate these moms as well.
Absolutely.
Bahar, I'd love to get your thoughts on remote care platforms and how you really cater to your patients, given most of the services at the practice are brick and mortar.
So we do offer virtual when it's convenient for our patients, and it's strictly around reviewing lab results, medication refill. We believe in the brick and mortar because I think we've set out to create a space where your mindset also shifts once you walk in. You're allowed to give yourself that time to take care of your body, take care of your wellness. There's nothing to feel guilty about exploring hormone therapies, about getting some neurotoxins if that's what makes you happy. So I like the brick and mortar approach because we've created an environment where it's safe for the patients, but you're allowed to have the time to check out and take care of yourself. And again, I think coming back to our staff creates a very homey feeling for our patients. They're very welcoming. We know each and every one of our patients. Multiple people know each and every one of our patients. And our staff is very supportive from check-in to taking you back, our ultrasound tech. So we try to approach it like you've come into our home and let's take care of you. And we can only accomplish that with a brick and mortar.
Mm-hmm. I love that idea of taking a pause and taking care of your body, because what's more important, right? You're offering both a physical and mental break to focus on yourself.
Yeah. And I think women generally don't take that time. They're taking care of their families. They're taking care of their husbands. They're taking care of their parents. They don't take the time for themselves. And we wanted them to feel good about taking that time for themselves.
Yeah. And I don't want to skip over it. The robes, it is a very comforting experience.
Yes.
And you're raising the bar by doing something that people want to experience.
Yeah. Yeah.
Yeah.
And Maral, your family opened up a family-owned private practice when it seems like those are less and less common. What other types of tools and technology do you use to keep connected on the medical side?
Yeah, I think, our approach to this was prioritizing patients, right? So in an effort to customize our care, we do our best to listen and spend the time that's necessary. We have some patients that come in and maybe they have more so of they know what they want to do, or it's a more straightforward visit, so they don't require as much time. And then we have some people that come in and we have to spend the time to educate, and that can take several visits and not visits that are 6 months apart, closer together. So it's really not a one-size-fits-all concept. And we have that flexibility in private practice versus larger healthcare organizations. I think something that we absolutely do is, we're very good about staying up to date with education. Dr. G and I go to conferences. And the big part of all of this is educating our team as well, because they are part of the practice, right? They need to understand some of the basics. And so we spend a lot of time educating them. And I think that helps us connect with our patients even more, because multiple people can be involved in their care. It doesn't just have to be myself, at every level.
And education is such a big piece of the patient experience,
Absolutely.
Whether you're 60 or 16.
Exactly. And I think that is where we shine, is everybody is up to date and up to speed on things. And things change constantly in medicine, and we have to be adaptable and change with it.
Mm-hmm.
Yeah, that's the only way you're going to be your best advocate for your patients.
Correct. Absolutely.
Yeah. I mean, I remember my first gynecology appointment when I was probably 15 or 16, and I don't remember feeling comfortable asking questions or being in an environment that was welcoming at all.
Yeah.
So
Yeah. To that point, I had a patient most recently who was in her early 20s, and she came with her mother and was so incredibly anxious for her first GYN annual, first PAP exam. And just because of stories she had heard from friends and family. And, she was so anxious about the visit and how to talk about that. And, it's a big thing. So everyone knows how to approach these patients in the office. It's not your standard in and out. This takes a little more time and education on what are we doing today? What is a speculum? What is a pap smear? Basic things, but we have to talk about them.
yeah. And I can
Absolutely.
imagine for that age group, they're getting a lot of information online.
Yeah, which actually makes it more important for them to have a provider that they know and trust to decipher through that information with, because not everything you find online is real.
Yes,
It's true.
I get patients who come in and they see something on social media platforms, and that's just not the way you should be necessarily educating yourself on certain aspects of your health.
Yeah, and I think one of the things I've been hearing since we opened up our practice is a woman more in the perimenopause, menopause age whose daughters are becoming of age for gynecology exams and how they want things to be different than their first experience. And it really reminded us of why we're doing this, to reshape a lot of how women's health was talked about, was taken care of, for the next generation to have a better experience. So they're not talking about crinkled papers. They're talking about, hey, I go to an office, they see me within a week. If I have a UTI, they see me that same day. I wear a robe. It's a different experience all in all.
People are smiling.
Yes.
Yeah, I know. Whenever I get upset or frustrated, and again, back to me wanting to start the show, I remind myself that I have a lot more in terms of information and resources than my mother, let alone my grandmother
Right.
in generations. So it's just really exciting. All the work that you're doing and the other guests that we're having on Her House are doing for future generations too.
Well, all the work you're also doing to put this out there.
Yes.
Thank you.
Education, like you said.
Yeah. Which actually leads right into another thing I wanted to make sure that we covered. Advocating for my own health is something I really value, and I really want all of our listeners and women in general to feel empowered to do that. I mean, I've had friends tell me they don't like their GYN, or they feel nervous asking questions or being honest. What would you guys say to women who don't feel comfortable, or maybe they don't feel respected by their providers, and how to go about that?
Find another one. That's it. I compare this to dating. It takes a lot of going on dates till you find the right person. Don't settle, and find the one that fits you. There are excellent providers out there. If you're not vibing with somebody, if you're not getting what you need out of somebody, you have to find the person out there that aligns with you, your values, and what you're seeking. If it's education, if you want to talk about hormone replacement, if you don't, you need to find somebody who gives you a safe environment to discuss your concerns, and you feel that you trust them, that they have the education to give you the tools that you need to make the right decision for you. I would say if you're not feeling great about a provider, don't keep going back to them every year. There's excellent providers out there. Find a physician that works best for you.
I like the dating analogy. It's like, don't settle.
You don't settle to find your husband or significant other. Take the same approach with your physicians.
Yeah, I agree with that. I don't settle with some of the symptoms you're having. I get patients who come in their 20s and 30s, and they have really painful or heavy periods, and they don't understand what they should be doing. And most of the time it's like, well, just take a birth control and things will get better with time. But, there are alternative options. And same thing with menopause. I get a ton of women that come in perimenopause, menopausal stage, and they really are having symptoms that's affecting their day-to-day life. Like quality of life has changed. And a lot of the times they hear, well, just bear through it. You'll get through it. It's a few years. It'll end, because, hormone replacement therapy has X, Y, and Z perhaps connected to it. And again, that just comes down to education and finding the provider who is going to educate you, and you make the decision of what you want to do next.
And that physician is your advocate in the healthcare system. So that's why I say don't settle. You need to find somebody that you feel like can give you the right advice. If you need to go see a cardiologist or because of something they found in their labs, you need to trust that physician to advocate for you beyond just the gynecology world.
Mm-hmm. Yeah. Thank you guys so much for sharing all of this and all of your hard work in getting this practice up and running. Of course, I would say that if there are any listeners in the Cleveland, Ohio area, you need to check out Bahar and Maral's practice and Dr. G, their mother. Our closing ask is for you guys to give a shout out to another leader who is innovating for the betterment of women's health. Who would you like to recognize and why?
I would like to recognize Dr. Catherine Berndorf. She opened up the Motherhood Center of New York. Her website is themotherhoodcenter.com, and they offer comprehensive mental health treatment. It's a center for new and expecting mothers and birthing parents who are experiencing prenatal and postpartum depression, anxiety, PTSD, and postpartum psychosis. There's programs, there's therapy, there's group support, and lots more. I think is much needed in this country.
And if people want to follow your guys' work and learn more about advanced women's health and surgery and the well, what's the best way to do so?
They can follow us on our social media platforms. We have both Instagram and Facebook, so clevelandgyn.com for the Advanced Women's Health and Surgery, and the Well Westlake for the Well Westlake. So if there's any further information wanted, they can always call us also.
Sounds great. Thank you guys so much. It's always fun to talk to you, and this was really informative.
Thank you for having us.
Thank you for having
us.
Excellent.
Thanks for listening, and I hope you're able to share this podcast and what you learned with others who care about women's health. Whenever I get frustrated about a health concern or struggle, I always remind myself that I have more information than my mother did, and way more than my grandmother's. These innovations are so important, and we can't stop talking about them because those conversations result in progress for generations to come. I'd also really love to hear your stories, the stories that end in hallelujah, and the bummers. If you're comfortable, you can leave a voice message by going to her-house.com and clicking your stories. Again, that's her-house.com and your stories. Everything is 100% anonymous and always will be. I want to hear about your period, your doctor's visits, your PCOS, pregnancy, giving birth, what happens after birth, being postpartum, raising your daughters, caring for your mothers. I want to hear about sexual health, mental health, weird symptoms, your immune system, and seriously, any differences that you recognize between women and men, because we are different, down to the chromosomes that encode the entire maps of our bodies. People are researching these topics, and we're going to find them.